Stop scrolling right now. I need you to think about something. Last night's dinner, not what you ate. What time you ate it and what you ate first. If your blood sugar this morning was higher than when you went to bed, that wasn't random. Something you did last night without even realizing it caused that spike. And I'm going to show you exactly what it was and how to fix it starting tonight. I'm Dr. Megan Foster. I've spent over 20 years working directly with people managing blood sugar and diabetes. And here's what almost everyone gets completely wrong. They think their morning number is controlled by what happens during the day. Breakfast choices, walking after lunch, taking medications on time. But here's the truth nobody explains. Dinner controls your blood sugar more than any other single meal. Not the sugar in it, not even the total calories. It's the timing, the order you eat things, and what happens in your body while you sleep. That's the part that changes everything. Think back 10 or 15 years, you could eat later at night, heavier meals, maybe even dessert without thinking twice. And it didn't affect you the same way. Now, one normal dinner and your morning number jumps 20 or 30 points. Nothing dramatic changed overnight in your life. Your body just became less forgiving at night. This wasn't just aging. This wasn't you failing at managing diabetes. And this is not irreversible. What changed was how your body processes glucose after the sun goes down. And once you understand that, you can work with it instead of against it. Let me explain how this works in simple terms. Think of your bloodstream like a slow moving river at night. During the day, your muscles are active. They pull glucose out of your blood fast. You're moving around, thinking, working. Your body is using fuel constantly. But at night, everything slows way down. Your metabolism shifts into a different mode. If dinner releases glucose into your blood too quickly, it just sits there for hours, coating your tissues, stressing your cells, quietly raising your average blood sugar, which is what we measure as your A1C. Most people think A1C goes up from big spikes. That's not how it works. A1C rises from how long glucose stays elevated. Duration matters more than peaks. Now, let me show you the research that proves this. A large analysis published through institutions, including Harvard-affiliated research teams, followed thousands of adults with type 2 diabetes over multiple years. What they found was simple and unsettling. People eating similar diets and taking the same medications had very different A1C outcomes based on one thing: when they ate dinner and what they ate first. Late dinners with carbs eaten first raised A1C even when the total calories were the same. Same exact food, different order and timing, completely different biology. So in this video, I'm going to walk you through a practical dinner structure. Not a list of foods to fear, not impossible rules you can't stick to. A simple sequence that works with how your body actually functions at night. And the number one strategy I'm about to share is responsible for some of the fastest overnight glucose improvements I've seen in my practice, sometimes within just a few days. Please do not skip that part. But before we continue, if you're watching this because you're trying to understand your body and not punish it, type dinner matters in the comments right now. You're not alone in this. There are thousands of people watching who feel exactly the same way you do. Let me start with dinner timing. Here's the misconception. People think calories are calories and the time you eat them doesn't matter. That's not true. Your body's ability to handle glucose changes throughout the day. At night, your cells become more resistant to moving glucose out of your blood. That's a fact. When you eat within 2 to 3 hours of going to sleep, glucose stays elevated in your bloodstream much longer. Controlled trials have shown this. Earlier dinners reduce how long glucose stays high overnight, even when people don't change what they eat at all. Same food, earlier time, lower overnight exposure. So here's how to use this. Finish your last full meal at least 3 hours before you plan to go to bed. That gives your body time to process the glucose before your metabolism shifts into sleep mode. Now here's the common mistake. People skip dinner entirely thinking that's better, and then they snack late at night. That's actually worse. Random snacking keeps your blood sugar bouncing up and down all night long. Your body never gets a break. Eat a real dinner earlier, don't skip it and graze later. Now let's move to the next one. Fiber before carbs. Here's what people think. Fiber is just for digestion. But here's the reality. Fiber slows down how fast glucose enters your bloodstream. When you eat vegetables first before you eat starches, the fiber creates a physical barrier in your digestive system. Studies show this clearly. Meals where people ate vegetables first had lower blood sugar after eating compared to the exact same meal eaten in a different order. Here's how to use it. Always eat your vegetables before your starches. Always. Start your dinner with a salad or cooked vegetables. Then move to your protein and grains. And here's the mistake people make. They buy fiber powders or supplements and take them after the meal. It's too late. The fiber needs to be in your stomach first. Eat actual vegetables at the start of your meal, not a supplement afterwards. Now we're moving into the strategies that create bigger changes. Let's talk about protein first eating order. Here's the misconception. As long as your meal is balanced, the order doesn't matter. Wrong. Protein eaten first triggers hormones in your gut that slow your stomach from emptying and reduce how high your glucose spikes after you eat. Multiple studies have measured this. When people eat protein before carbs, their blood sugar after the meal is 30 to 40% lower compared to eating the same meal starting with carbs. Here's the sequence that works. Protein first, then vegetables, then your carbs last. Every single dinner, that order. And here's the mistake. People drink protein shakes after dinner thinking it's helping. The protein needs to hit your stomach first before the carbs do. Eat solid protein at the beginning of your meal, and now we get to the most powerful one. Carb timing at dinner. This is the real issue. Refined carbs or fast digesting carbs at night keep your blood sugar elevated for hours, not minutes. Hours. Even healthy carbs can do this if you eat them late. People focus entirely on sugar content. How many grams of carbs? They're missing the point. It's not just about how much. It's about how long the glucose stays in your blood. That's what raises A1C. That's what causes damage over time. This is why people count carbs perfectly and still can't get their morning number down. They're eating the right amount at the wrong time in the wrong order. Here's what works. Smaller portions of carbs at dinner compared to lunch, and always eat them last after protein and vegetables. That's the sequence that minimizes how long glucose stays elevated overnight. Let me be clear. I'm not saying never eat carbs. I'm saying respect the timing. Your body can handle carbs much better at lunch than at dinner, and it handles them better at the start of the day than at the end. Let me tell you what people say when they start doing this. I felt calmer after dinner. I didn't wake up thirsty in the middle of the night. My morning number finally made sense for the first time in months. That's not coincidence. That's your body working the way it's supposed to when you stop fighting how it functions at night. Now I know what some of you are thinking. Won't this mess with my medications? No. This works with your medication. It doesn't replace it. Don't stop taking anything your doctor prescribed. But over time, as your numbers improve, this approach may allow your doctor to reduce your doses. Start gradually. Change one thing at a time. Let your body adjust. Let me give you a practical challenge. For the next 30 days, do these 4 things. Eat protein first at dinner, every time. Finish dinner at least 3 hours before bed. Walk for 10 minutes after you eat. Just 10 minutes, nothing intense. And track your morning blood sugar. Don't change anything else. Just do these 4 things and let your body show you what happens. Write down your morning number every day. You'll see the pattern within 2 weeks. Some people see it within days. Here's what I want you to understand. You're not broken. You're not bad at managing diabetes. Your body is asking for a different rhythm at night. And once you give it that rhythm, control comes back. It's not about willpower. It's about timing and sequence. Now let me go deeper into why this works. When you eat carbs late at night, your body has to release a hormone called insulin to move that glucose out of your bloodstream. But at night, your cells are more resistant to insulin. That's normal. It's how humans are built. So your body has to release more insulin to get the same job done. More insulin floating around at night creates a cascade of problems. It prevents fat burning. It increases inflammation, it stresses your liver, and it keeps your blood sugar elevated longer because your cells just aren't responding well. Now, compare that to eating protein first. Protein triggers a hormone called GLP-1. You might have heard of it because there are medications based on it now, but your body makes it naturally when protein hits your digestive system. GLP-1 slows how fast your stomach empties. That means glucose enters your bloodstream more gradually instead of all at once. It also tells your body to release insulin in a steadier way instead of a big surge. And it increases how sensitive your cells are to insulin. All of that happens naturally just from eating protein before carbs. You don't need a prescription. You just need to eat in the right order. Now let's talk about fiber. When you eat vegetables first, the fiber doesn't just slow digestion. It also feeds the healthy bacteria in your gut. Those bacteria produce compounds that actually improve how well your body handles glucose. This is real science. Your gut bacteria affect your blood sugar control. When you eat fiber regularly, especially at the start of meals, you're feeding the bacteria that help you. When you skip vegetables and go straight to carbs, you're feeding the bacteria that make things worse. It's a cycle, and it goes in whichever direction you push it. Here's another thing that happens when you eat dinner earlier. Your body gets a longer fasting window overnight. Let's say you finish dinner at 6 p.m. and you don't eat again until 7 a.m. the next morning. That's 13 hours. During that time, your insulin levels drop. Your body shifts into fat-burning mode. Your cells start cleaning up damaged proteins and clearing out waste. It only happens when insulin is low for an extended period. If you eat late and then eat early, you never get that window. Over time, that adds up. Damage accumulates, blood sugar control gets worse. Let me give you a real example of how this plays out. Let's say you eat dinner at 8:30 p.m. Pasta with chicken and a side salad. You eat the pasta first because it's hot and ready. Then the chicken. Then you pick at the salad. You're done eating by 9. You go to bed at 10:30. Your blood sugar spikes from the pasta around 9:30. But you're already winding down for bed. Your cells are becoming more resistant as part of your natural rhythm. So glucose stays high. You fall asleep with elevated blood sugar. It stays elevated for hours because your metabolism is slow overnight. You wake up at 6:30 a.m. and your blood sugar is still higher than it was before dinner. You feel sluggish. You're frustrated. Now let's replay that same dinner with the strategies I just taught you. You eat at 6 p.m. instead of 8:30. You start with the salad. The fiber gets into your system first. Then you eat the chicken. Protein triggers GLP-1. Your stomach empties slower. Then you eat a smaller portion of pasta last. Glucose enters your bloodstream gradually. Your insulin response is steadier. By 7 p.m., you're done eating. You take a 10-minute walk around the block. That walk uses up some of the glucose immediately. Your muscles pull glucose out of your blood without needing insulin. By 8 p.m., your blood sugar is coming back down. By 9:30, when you go to bed, it's in a healthy range. You sleep soundly. Your body has time to fast and repair. You wake up at 6:30, and your blood sugar is lower than it was before dinner. You feel rested. You're not thirsty. Your morning number makes sense. Same food, different timing and order, completely different outcome. This is why I keep saying it's not about what you eat as much as when and how you eat it. You don't have to give up pasta forever. You just have to eat less of it, eat it last, and eat it earlier in the day. Now let's talk about what happens over time when you do this consistently. In the first week, most people notice better sleep, less waking up to use the bathroom, less thirst at night. Those are signs that your blood sugar isn't spiking overnight. In the second week, morning numbers start to stabilize. The wild swings calm down. By week 3 or 4, you'll notice patterns. Your morning blood sugar becomes predictable. You understand what works and what doesn't. And by the end of the first month, many people see their fasting glucose drop by 10 to 20 points. That's enough to start making a real dent in A1C over time. But here's the important part. This only works if you're consistent. Doing it 3 nights a week won't cut it. Your body needs a steady rhythm. It needs to know what to expect. When you eat dinner at 6 p.m. 4 nights a week and then 9 p.m. the other 3 nights, your metabolism can't adapt. Think of it like sleep. If you go to bed at 10 p.m. most nights, but then stay up until 2 a.m. twice a week, your sleep quality suffers all week long. It's the same with meal timing. Consistency builds the result. Now, let me address something I hear a lot. What if I work late? What if I can't eat dinner at 6 p.m. because I don't get home until 8? Here's what you do: eat a solid snack in the late afternoon, something with protein and fat, a handful of nuts and some cheese, a hard boiled egg, and some veggies. That holds you over. Then, when you get home at 8, eat a lighter dinner. Skip the heavy carbs entirely or just have a very small portion. Focus on protein and vegetables. You're eating late, so you need to adjust what you eat to match. That's better than skipping the afternoon snack, coming home starving, and eating a huge plate of pasta at 8:30. Here's another question I get. What about people who do shift work or work overnight? The principles still apply, but you flip them. Your dinner is the meal before your longest sleep period, whenever that is. If you sleep during the day, eat your last meal at least 3 hours before you go to bed. Use the same sequence: protein first, vegetables, small carbs last. Your body still has a rhythm, even if it's shifted. Let me also talk about dining out because that's where people get tripped up. You can still eat at restaurants and follow this structure. Order your meal and ask for the salad or vegetable side to come out first. Eat that while you're waiting for the main course. When the main dish arrives, eat the protein first. Cut into your steak or fish or chicken. Eat most of that. Then have your vegetables. Then, if there's a starch on the plate like rice or potatoes, eat a few bites of that last. You don't have to finish it. Most restaurant portions are oversized anyway. If people at the table ask why you're eating that way, just say you're trying something new for your blood sugar. Most people will respect that and move on. Now let's go back to the walking piece because I don't want you to skip that. 10 minutes of walking after dinner is one of the most underrated tools for blood sugar control. Here's why it works. When your muscles contract, they pull glucose out of your bloodstream without needing insulin. You're literally using the glucose as fuel. Even a gentle walk makes a measurable difference. Studies show that a 15-minute walk after a meal can lower the blood sugar spike by 20 to 30%. You don't need to power walk. You don't need to break a sweat. Just move. Walk around your neighborhood. Walk around your house if the weather is bad. The movement matters more than the intensity. And here's the bonus. Walking after dinner also helps with digestion. It keeps things moving through your system. A lot of people with blood sugar issues also deal with bloating or constipation. Walking helps with that too. It's a simple habit that compounds. Better blood sugar, better digestion, better sleep, all from 10 minutes of movement. Now I want to talk about stress and sleep, because these matter more than most people realize. If you're doing everything right with dinner, but you're sleeping 4 hours a night and you're stressed out of your mind, your blood sugar will still be a mess. Lack of sleep increases a stress hormone called cortisol. Cortisol raises blood sugar. It also makes you more resistant to insulin. Stress does the same thing. I'm not saying you need to sleep 9 hours every night. That's not realistic. But you need to prioritize sleep as much as you can. Go to bed at a consistent time. Make your room dark and cool. Limit screens before bed. These things matter. Your blood sugar doesn't exist in a vacuum. It's connected to everything else. Let me tell you about Lisa. She came to me frustrated. She'd been trying to lower her A1C for over a year. She was counting carbs perfectly, taking her medication, exercising 3 times a week. But her A1C was stuck at 8.2. We went through her routine and I noticed she was eating dinner at 9 p.m. most nights. And she was eating bread or rice first. I had her make 2 changes: move dinner to 7 p.m. and eat protein and vegetables before any starches. That's it. 2 changes. Within 6 weeks, her fasting glucose dropped from 150 to 120. 3 months later, her A1C was down to 7.1. Same medications, same exercise routine, just different timing and order. That's the power of working with your body instead of against it. Lisa didn't need more willpower. She didn't need a stricter diet. She just needed to understand how her metabolism functions at night. Now, let me give you one more practical tip. Prep your dinner vegetables in advance. On Sunday, chop up bell peppers, cucumbers, carrots, whatever you like. Store them in containers in the fridge. When you get home and you're tired, you can grab a container and start eating those while you cook the rest of your meal. It removes the friction. You're more likely to eat vegetables first if they're already ready to go. Small changes in your environment make the behavior easier. Here's what I don't want you to do. I don't want you to try to overhaul your entire life overnight. Don't throw out all your food. Don't start 3 new supplements. Don't sign up for a gym membership you won't use. Just start with the dinner sequence. Protein first, vegetables, small carbs last. Do that for 2 weeks and see what happens. Then add the timing piece. Move dinner earlier gradually. Then add the 10-minute walk. Build the habit stack one piece at a time. And please track your blood sugar. Write it down every morning. Take a photo of it. Whatever works for you. Because when you see the pattern change, that's what motivates you to keep going. You're seeing evidence that this works for your body. Let me also say this. Some nights you're going to mess up. You're going to eat late. You're going to eat carbs first. You're going to skip the walk. That's fine. One night doesn't ruin everything. Just get back to the routine the next day. Progress is not perfection. It's consistency over time. If you follow this structure 80% of the time, you're going to see results. Now I want to address one more thing. Some of you might be thinking, this sounds too simple. There has to be more to it. There has to be a supplement or a special food or a secret trick. And I understand that feeling because we've been conditioned to think that solutions have to be complicated. But the truth is, the most powerful tools are often the simplest ones. Eat protein first. Eat dinner earlier. Walk after you eat. These are not sexy strategies. They're not going to sell a product. But they work because they align with how your body actually functions. Your body is not broken. It's just following rules you didn't know existed. Once you learn the rules, you can play the game differently. Now, let me talk about hydration because this connects to everything we've discussed. When your blood sugar is high, your kidneys try to flush out the excess glucose through your urine. That's why you wake up thirsty at night or need to use the bathroom multiple times. It's your body trying to get rid of the glucose. But here's what most people don't realize. That process also flushes out important minerals. Sodium, potassium, magnesium. These minerals help your cells respond to insulin. When you're constantly losing them through urination, your blood sugar control gets worse. It becomes a vicious cycle. So, what do you do about it? First, stay hydrated during the day. Don't wait until you're thirsty. Drink water consistently. Aim for at least 8 glasses. But here's the key. Don't drink a ton of water right before bed thinking it will help. That just makes you wake up more often. Front load your water intake earlier in the day. Drink most of your water before 6 p.m. Then sip as needed in the evening. Second, make sure you're getting enough minerals in your diet. Leafy greens are packed with magnesium and potassium. Nuts and seeds have magnesium. If you're eating vegetables first at every dinner like I recommended, you're already doing this. But if you're someone who's been skipping vegetables for years, you might need to focus on this more intentionally. And if you're taking a diuretic medication for blood pressure, talk to your doctor about whether you need to monitor your mineral levels. Some people do need supplements, but don't start taking things without checking first. Here's something else about hydration. Sometimes what feels like hunger late at night is actually thirst. Your body sends similar signals for both. Before you reach for a snack at 9 p.m., drink a glass of water and wait 10 minutes. Often the craving goes away. This helps you stick to that 3-hour window before bed without eating. Now let's talk about alcohol for a minute because I know this comes up. Alcohol affects blood sugar in tricky ways. Initially, it can cause your blood sugar to drop because your liver stops releasing stored glucose while it's busy processing the alcohol. But then later, especially if you had a sweet drink or mixed it with juice or soda, your blood sugar can spike. And alcohol disrupts your sleep quality even if it makes you feel drowsy at first. Poor sleep makes blood sugar control worse the next day. It's a mess. If you're going to drink, here's what minimizes the damage. Don't drink on an empty stomach. Have it with dinner after you've eaten your protein and vegetables. Choose drinks that aren't loaded with sugar. Wine or spirits mixed with soda water instead of cocktails with juice and syrup. Limit yourself to one drink and make sure you drink water alongside it. 1 glass of water for every alcoholic drink. This helps with hydration and slows down how much you consume. But honestly, if your blood sugar is really struggling and you're trying to get control, the best thing is to cut out alcohol completely for 30 days while you implement these other changes. See what your numbers do. You can always add it back in small amounts later once you've established a baseline. I'm not saying you can never have a glass of wine again. I'm saying give your body a chance to reset first. Now, let's discuss portion sizes because this matters more than people think. Even if you're eating in the right order, if you're eating massive portions, your blood sugar is still going to spike. Here's a simple way to think about portions without weighing food or counting anything. Your protein should be about the size of your palm, not your whole hand, just the palm. Your vegetables should fill half your plate. And your carbs, if you're having them, should be about the size of your fist. That's it. Those are rough guidelines, but they work for most people. The problem is restaurant portions are often 2 or 3 times that size. A pasta dish at a restaurant might be 4 servings. A steak might be 12 ounces when you only need 4. This is where eating at home gives you more control. You can plate your food the right way from the start. When you do eat out, ask for a to-go box. Right when your food arrives. Put half of it away before you start eating. Then you're not tempted to keep picking at it just because it's in front of you. Another trick is to use smaller plates at home. This sounds silly, but it actually works. When you put food on a smaller plate, the portions look bigger and your brain registers satisfaction more easily. It's a psychological thing. You're not depriving yourself, you're just working with how your brain perceives fullness. Now I want to talk about what to do when you hit a plateau. Let's say you've been doing everything right for 6 weeks. Your blood sugar improved at first, but now it's stuck. You're frustrated because you feel like you're doing all the right things, but the numbers aren't budging anymore. This happens to almost everyone. Here's why. Your body adapts. What worked in week 1 might not be enough in week 6. You might need to tighten things up a bit. Maybe you've been finishing dinner at 8 p.m. and that worked initially, but now you need to move it to 7 p.m. Maybe you've been walking 10 minutes, but now you need to push it to 15. Maybe your carb portions have slowly crept up without you noticing. This is where tracking becomes really important. Go back and look at your food diary if you've been keeping one. Look for patterns. What changed between when your numbers were dropping and now when they're stuck? Sometimes the plateau isn't about food at all. It's about stress or sleep, like I mentioned earlier. If something stressful happened in your life in the past few weeks, that could be stalling your progress. Stress hormones directly raise blood sugar. They also make you crave comfort foods and disrupt your sleep. All of that works against you. You might need to add stress management practices. Deep breathing for 5 minutes before bed. A short meditation in the morning. Going for a walk during your lunch break to clear your head. These aren't luxuries. They're tools that directly affect your blood sugar. And here's something most people don't know. Your menstrual cycle affects blood sugar if you're a woman who still has periods. Insulin resistance increases in the week before your period starts. That means your blood sugar might be higher during that week, even if you're doing everything the same. Don't panic when you see that. Just note it. Expect it. Maybe tighten up your routine a bit during that week. Smaller carb portions, longer walks. It's not forever. It's just 1 week out of the month. For women going through menopause, the hormonal changes also affect blood sugar. Estrogen helps with insulin sensitivity. As estrogen drops, insulin resistance can increase. This is why some women who never had blood sugar issues suddenly start seeing higher numbers in their late 40s or 50s. It's not your fault, it's hormones. The same strategies still work. You just have to be more consistent with them. Now let's talk about eating out for special occasions. Birthdays, holidays, anniversaries. You don't want to miss out on life because you're managing blood sugar. And you shouldn't have to. Here's how to handle it: plan ahead. If you know you have a dinner out on Saturday night, be extra tight with your routine the rest of the week. Protein first every meal, no exceptions. Walks after every dinner, get your sleep. Then on Saturday, do the best you can. Order something with protein and vegetables. Eat those first. If there's cake for dessert, have a small slice. Enjoy it. Don't feel guilty. Just get back to your routine on Sunday. One meal isn't going to ruin your progress. It's what you do most of the time that matters. The mistake people make is they think one special meal gives them permission to spiral for the whole weekend. They eat out on Saturday and then figure Sunday is already ruined, so they might as well keep going. Then Monday, they feel terrible and it takes them until Wednesday to get back on track. Don't do that. Enjoy the meal, then move on immediately. Now, here's an advanced strategy for people who are really struggling with morning blood sugar: the dawn phenomenon. Your liver naturally releases glucose into your blood in the early morning hours to wake you up and give you energy. That's normal. But if you have diabetes or prediabetes, your liver can release too much. This is why some people wake up with blood sugar that's higher than when they went to bed, even though they didn't eat anything overnight. There are a few ways to manage this. One is to make sure you're eating enough protein at dinner. Protein helps stabilize blood sugar overnight. If your dinner is mostly carbs with very little protein, your liver might overcompensate in the morning. Two is to eat dinner even earlier than the 3-hour window I mentioned. Some people do better with 4 hours. Three is to do some light movement right when you wake up. 10 minutes of stretching or walking. That tells your liver to stop releasing glucose because you're using it for activity. And four is to talk to your doctor about medication timing. Some medications work better when taken at night to specifically target that morning release. Let me also mention continuous glucose monitors because some of you might be using them. These are devices that track your blood sugar 24/7. They can be incredibly helpful because you see exactly how different foods affect you in real time. You don't have to guess. You eat something, and 2 hours later, you can see what happened. But here's the thing: don't become obsessed with every little spike. Blood sugar goes up after you eat. That's normal. What matters is how high it goes and how long it stays there. If you see a spike to 180 after a meal, but it comes back down to 120 within 2 hours, that's actually okay. It's when it spikes to 250 and stays there for 4 hours that you have a problem. Use the monitor as a learning tool. Test different foods in different orders. See what happens when you eat vegetables first versus carbs first. See what happens when you walk after dinner versus sitting on the couch. Gather data. Then use that data to make decisions, but don't let it stress you out. Stress raises blood sugar too, remember. Now let me talk about what happens if you travel. Different time zones, airplane food, hotel breakfasts. It's tough to stick to a routine. Here's what I tell people: do the best you can with what's available. If you're on a plane and the meal comes with a roll, a piece of chicken, and some vegetables, eat the chicken and vegetables first. Skip the roll or save it for later if you're hungry. If you're at a hotel breakfast buffet, load up on eggs and vegetables. Skip the pastries and waffles, or have a very small portion. Walk around the city or hotel instead of sitting in your room after meals. The key is not to use travel as an excuse to completely abandon everything. You don't have to be perfect, but you also don't have to throw your hands up and eat whatever just because you're not at home. Traveling is stressful enough on your body. Don't make it worse by sending your blood sugar on a roller coaster. And bring snacks with you: nuts, cheese sticks, jerky, hard-boiled eggs if you have a cooler. This way, when you're stuck at an airport or in a car and you're hungry, you have something to eat that won't spike your blood sugar. Don't wait until you're starving and then grab whatever is available. Plan ahead. Here's another tip for social situations: family gatherings where everyone is pushing food on you. Coworkers bringing donuts to the office, friends ordering appetizers and desserts. You don't have to explain your whole health situation to everyone. Just say you're not hungry right now or you already ate. If someone pushes, say you're trying to cut back on sugar for a bit, Most people will accept that and move on. You don't owe anyone an explanation for what you choose to eat or not eat. And if you do decide to have something, make it a conscious choice. Don't eat it because you feel pressured or guilty. Eat it because you actually want it and you've decided it's worth it. Then enjoy it without guilt. Guilt and shame don't help your blood sugar, they just make you feel bad. Now let's talk about what to do if you live with other people who don't have blood sugar issues. Maybe your spouse eats pasta every night. Maybe your kids want cereal for dinner. You can't force your routine on everyone else, but you also can't let their eating habits derail you. Here's what works: cook meals that work for everyone, but plate them differently. Make pasta with chicken and vegetables. Everyone else gets a big portion of pasta with some chicken and veggies on the side. You get a big portion of chicken and veggies with a small portion of pasta on the side. Same meal, different ratios. Or make components instead of combined dishes. Grilled chicken, roasted vegetables, rice or potatoes. Everyone builds their own plate based on what they need. Your family can load up on rice. You can load up on vegetables and chicken. Nobody feels restricted or singled out. The key is to stop thinking of your way of eating as a special diet that's separate from normal food. It's just food. You're just eating it in a different order and in different amounts. That's it. The same food everyone else is eating. You're not making separate meals. You're not eating weird things. You're just being more strategic about it. Now, I want to give you some specific meal ideas because I know it helps to have examples. Breakfast: scrambled eggs with spinach and tomatoes. A small piece of whole grain toast on the side if you want it. Eat the eggs and vegetables first, then the toast. Or Greek yogurt with berries and a handful of nuts. Eat the yogurt and nuts first, then the berries. The pattern is always the same: protein and fiber first, carbs last if at all. Lunch: grilled chicken salad with lots of vegetables and olive oil dressing. A small roll on the side. Eat the salad and chicken first, then the roll if you're still hungry. Or a turkey and avocado wrap. Eat half the wrap and fill up on baby carrots and cherry tomatoes first. Save the second half for later if you need it. Dinner: salmon with roasted broccoli and a small sweet potato. Eat the salmon and broccoli first, then the sweet potato. Or stir fry with lots of vegetables, some chicken or tofu, and a small portion of rice. Eat the vegetables and protein first, then the rice. Or tacos with seasoned ground turkey, lettuce, tomatoes, cheese, and small tortillas. Eat most of the filling without the tortilla first. Then have one or two small tacos. See the pattern? You're not eating strange food. You're eating normal food in a smarter order with adjusted portions. That's it. Here's your action plan for tonight. Whatever you're having for dinner, eat the protein first, even if it's just a few bites. Then eat your vegetables. Then, if you're having carbs, have a smaller portion than usual and eat them last. Finish eating at least 3 hours before you plan to go to bed. After you eat, walk for 10 minutes. Before you go to bed, check your blood sugar and write it down. When you wake up tomorrow, check it again. Compare the two numbers. That's your baseline. Do the same thing tomorrow night and the night after that. By the end of the week, you'll start to see a pattern. And if you want more detailed guidance on this, I've put together a resource called the Longevity Guide. It walks through this entire framework step by step with meal examples, timing charts, and troubleshooting tips for common issues. You can find the link in the description below this video. Thank you for watching the video. I'll see you next time.